15th of November marks World Diabetes Day. The global campaign theme for this year, well, next year and in 2023, is access to diabetes care. If not now, when? In South Africa, diabetes affects approximately 4.5 million people. The proportion of the adult population living with the condition is estimated around 12.8%, and it is the leading cause of death among women. To talk more about this, we're joined by physician endocrinologist at the Arwyp Medical Center, Dr. Regina Mampane. Doctor, very good evening to you. Welcome to Newsfeed PM, and thank you for your time tonight. So, the numbers are staggering as far as diabetes in South Africa. What are the drivers?
Good evening. Thank you very much for inviting me. Yes, it is true that there's an estimated number of around 463 million people living with diabetes, and most of them are undiagnosed. And in South Africa, 4.5 million people are living with diabetes and they're still undiagnosed, and around 5 million people have pre-diabetes and they don't even know it. So the drivers are mainly we have to identify patients who are at risk of developing diabetes, mainly people who are older than 45, people who've got a first degree relative of diabetes, and pregnant females who had diabetes when they were pregnant, anyone with an increased BMI of more than 25 who've got high blood pressure or high cholesterol also needs to be investigated and screened for diabetes.
And let's talk about the screening. You say a lot of people are undiagnosed. Why do people go undiagnosed, and how long really can you go unaware that you're even diabetic?
Unfortunately, diabetes is a silent killer, so most patients are asymptomatic, and around 30% of type 2 diabetic, by the time they are diagnosed, already have developed complications. So we have to know and try by all means to screen and identify patients who are at risk of developing diabetes.
Pre-diabetic, when we say someone is pre-diabetic, I know I've heard, at least from my group of friends and some colleagues who are pregnant, to say, well, they went to the gynae and they were told that they're pre-diabetic.
Yes, pre-diabetes means that your blood glucose levels are high, are above normal, but they're not high enough to be diagnosed as diabetic. And those patients are at risk of developing diabetes as well as diabetes-related complications.
And I mentioned pregnant women who sometimes battle with that issue. How important is it, especially for expecting mothers, to have that checked out?
Okay, so there is a concept known as gestational diabetes. So these are patients who usually have diabetes when they are pregnant, and then the minute they deliver, then they don't have diabetes anymore. So they're at risk of developing type 2 diabetes later. And unfortunately, gestational diabetes also puts a risk not only on the mother, but also on the baby.
And is it as easy, Dr. Mampane, as just a change in diet to avoid being diabetic?
It might be, especially for people who are at risk of developing type 2 diabetes. We usually advise them to exercise at least 30 minutes 5 times a week, and to also have a healthy diet. If you exercise as well as have a healthy diet, there is a degree that you can prevent and even delay onset of diabetes.
And what's frightening about diabetes, I mean, most of us would have seen perhaps people who've had a limb amputated, but there are various other complications that can come with diabetes. For example, I was reading today about people whose hearing becomes affected as a result.
Yes, diabetes there are a lot of complications from diabetes. People can get blind from it or can develop cataracts. It is the leading cause of kidney failure in developed countries. It puts patients at risk of stroke as well as heart disease or even heart failure. There is a risk of leg amputation as well as peripheral neuropathy, whereby diabetes affects their nerves, and these patients are at risk then of leg amputation later on.
We talked about expecting mothers. Let me ask you about children. How prevalent is diabetes among children?
Oh, unfortunately, I'm a physician endocrinologist, so I see patients who are 13 years and older. But I do know that pediatric endocrinologists do see a lot of diabetic patients, and especially now you get obese kids, so they are really seeing younger patients who are diabetic.
So you see 13 and older. How, in terms of the scale, the age scale, what age ranges, where are you seeing the most problems as far as people who are actually diabetic and on the more extreme end of the diabetes spectrum?
I'll say between age 21 to 79, and most patients usually do develop, they present already having developed complications of diabetes.
We speak, when we talk about the likes of, for example, HIV, the importance of taking the antiretrovirals on time every day. Let's talk about compliance with the prescription for diabetes and people taking their meds as and when they should. Why is that so important to get right?
Okay, so firstly, it is very important to diagnose and treat them early. So if they are compliant, obviously if their blood glucose is normal, we know that the more they have sort of uncontrolled diabetes, they're at risk of developing complications. So our aim of treatment is to treat them so that they are well controlled, so that we can prevent as well as delay complications.
So good to speak to you, Dr. Regina Mampane, speaking to us today ahead of World Diabetes Day tomorrow. Enjoy the rest of your evening.
Thank you.